At Compass CHC, we are increasingly approached by individuals who understandably want to know what our success rate is in securing continuing healthcare funding for our clients. Now, we do have a very high success rate because in the main we ensure that we have a very robust screening process at the outset prior to even accepting instructions to act on an individual's behalf. Our team of experts will take the time to go through in full over the telephone and gather as much information as is possible about what the particular needs the patient has. Armed with this information, they will be able to cross-refer it to the criteria to be able to take a preliminary view as to whether there is an entitlement to funding on the basis that the needs are sufficiently complex, intense or unpredictable in their nature. That is the criteria for what's considered a primary health need, and that is the determination as to whether somebody is entitled to continuing healthcare funding or not. Now, what I would suggest to everyone and anyone considering instructing somebody, a third party, to assist with securing continuing healthcare funding, is that you ask several questions about who they are and what their expertise are. They should also be undertaking a significant preliminary assessment in the manner that Compass CHC operates, because how can they possibly advise you that there is a case that is worth pursuing on behalf of the patient if they're not armed with this information? Be very wary of anyone that promises the earth and has very little substance to back up their claims as to what their expertise are. Now, in terms of success rates, as I say, Compass CHC do enjoy a high success rate, but there are circumstances when it can be difficult to secure funding on behalf of a patient and that prevent a successful outcome. These are limited, but nevertheless they do occur. One example would be where an individual improves, and so the point at which the preliminary assessment is undertaken, there is clearly primarily a health need. The needs are intense, complex or unpredictable, and yet following instruction, their health needs vastly improve. Now, this is of course fantastic news from the perspective of the patient's health, but clearly if they no longer meet that determination of primarily having health needs, they will not be entitled to continuing healthcare funding. Another example of where a case may not succeed would be if the patient's needs are intense, complex and unpredictable in their nature, and yet there is no independent evidence to be able to corroborate the same. Unfortunately, like anything, there are good care homes and bad care homes, and if the record keeping does not accurately reflect what the individual's needs are, then there is no independent evidence to be able to present to the NHS assessment team to be able to corroborate the position that the needs support an entitlement to the funding. Equally, if the evidence downplays the needs that you know to exist, then that again can be a problem and can prevent the success of a case. What we would also, well, as an aside to this, linked to it, we would suggest that as an individual looking after a patient, you ensure that the record keeping is accurate. Now, you're entitled to ask the care home to show you that they have accurately recorded what the patient's needs are. So if, for example, you are told about an incident of challenging behaviour or an issue with a fall, you can ask to be shown that the same has been reflected in the records, and in the overreaching care plans, a plan of action has been taken to address the issues that you know are occurring. By taking this action, you are ensuring the records accurately reflect what the patient's needs are. So at the point in time that you need to secure that evidence to be able to present to the NHS to back up the case that they are entitled to continuing healthcare funding, the evidence is there. Now, the other factor can be not so much a case of if you will win the pursuit of continuing healthcare funding, but rather when. And by that I mean that you may be unsuccessful at an assessment stage, and it may be necessary to invoke the full appeals procedure. Now, that can either be a successful appeal at a local level, or it could be necessary to take matters to NHS England, or indeed even the Health Ombudsman. Because you've not been successful at an earlier stage does not mean necessarily that the patient is not entitled to continuing healthcare funding. It may be necessary to doggedly pursue and invoke the full appeals procedure to be able to get the outcome that you are entitled to, or the patient indeed is entitled to, which is namely continuing healthcare funding to meet the cost of their care. What I would say, and the manner in which I would suggest you proceed, would be that if you have any questions about continuing healthcare funding and you are considering instructing a third party, contact Compass CHC and speak with one of our experts. You can complete an online assessment and one of our experts will contact you at a convenient time, and this is available via our website at www.continuing-healthcare.co.uk. Equally, you may wish to contact us directly by telephone on 0121 227 8940. We'll be more than happy to take as much time as is required to talk you through the process and to discuss the particular circumstances of your relative and what their health needs are, and we can then take a view as to whether there is anything that can be done to assist them. Thank you.